The new COVID-19 variant called VUI 2020-12/01 spreads far more easily between people as a result of the series of mutations that have been identified in the genetic coding. The variant is more easily transmittable. However, it is not believed to cause more severe symptoms of the COVID-19 disease or lead to higher rates of mortality. A question still lingers: is it a new strain, variant, or a mutation? Head of Infectious Diseases in the Ministry of Health, Professor Lloyd Mulenga, explains more.
But in this case of the virus, from the original or the parent virus, we know that these changes happen, especially with viruses, but they happen with other organisms as well, bacteria, you can have those changes. Basically on the COVID so far, there are about 6 areas where the changes have been. And the one which is most important and also crucial is the part which the virus uses to attach to the respiratory cells in the lungs, in the airways. Now, if you have a change on that part, it's called a spike protein. That protein, which is an attachment to the virus, to the human cell, is the one which may have bad changes, and there's a specific one which people are worried of on a certain position called 501 of this genetic material of the virus. So this specific one likely has a higher ability to attach to the human cells.
Professor Mulenga discloses that some samples have been taken from Zambians and are being tested for the new variant.
So we are also closely looking at these changes. We have some suspicious, one suspicious case who traveled from UK. We're waiting for the results. If they are positive because they have symptoms, then we may need now to also sequence or to look at the genetic makeup to see if there are differences between this genetic makeup of this virus and the parent virus or the viruses which we have been seeing previously.
Following the announcement by the Ministry of Health that Zambia will begin to receive COVID-19 vaccines by the end of February 2021, the Oxford AstraZeneca vaccine has been identified as the one to be received.
Each country also has a preference on which type of vaccine they may have. So for Zambia, we opted to have the vaccines which we can be able to store and also be able to safely give and also safely monitor, not those which need very cold temperatures, so the ultra cold chains. What that means then is that the leading candidate of the vaccines we're going to get is likely the Oxford AstraZeneca vaccine. Now, we have also indicated willingness to have the Pfizer or the Moderna vaccines, but in smaller quantities.
The country currently stands at a total of 19,234 confirmed COVID-19 cases, with 18,036 recoveries and 381 deaths. Virginia Chilongo, Movie TV News, Lusaka.